All right, good morning, everybody. So the Bulldog Bulletin, make sure you take a look at that. So they're looking for a VA work study, hiring tutors. What did they mention? Career service team. So get to know them. So they can help you with your resume. And then, of course, we have graduation June 8th at 6 p.m. And that's going to be at the Spreckles Organ Pavilion, Balboa Park. Just no balloons because it's right next to the zoo and they don't want the animals getting harmed. So certifications, so if you're in healthcare, they got a great list of those who got certified. And the last thing they talked about was student ambassadors. So this was formerly the healthcare and leadership club. So if you guys want to join a national city, it is now the Student Ambassador Club. So they're the ones that came up with the healthcare t-shirts. So for every Wednesday, you guys can wear your healthcare t-shirt. All right, you guys ready for the endocrine system? All right, endocrine system. So endo is going to be within. So these substances are going to be secreted into the blood system. So this is different from exo. Exocrine is to the outside. For example, sweat. Sweat and oil glands. There's a duct and the products are secreted to the outside. Whereas endocrine gland goes within the body. Hormones, two types, and you got to remember the structure of the cell wall, or sorry, the cell membrane. It's made out of fats. So like dissolves like. So the gland will secrete its hormone, enters into the blood, hence endocrine, and then goes to the target tissue. And it's going to react with the receptors. So if there are no receptors that the hormone reacts with or interacts with, then there's no result. So it's just like the key and lock analogy. So no ducts. So if you were exocrine, you would have ducts, sweat glands, sweat pores. So here, endo directly into the bloodstream. All right, the first type is going to be steroid-based hormone. So steroid base is cholesterol base. So cholesterol is like the blank key. And in order to turn cholesterol into testosterone, vitamin D, estrogen, progesterone, all you have to do is change and cut out some teeth in the blank key. So since it's made out of fat and the cell membrane is made out of fat, it can cross the cell membrane easier. Also, since the nuclear membrane is made out of phospholipids, it can enter into the nucleus and turn on and turn off DNA directly. So it can turn on genes and turn off genes. So here's an example. In the bloodstream, the lipid base or fat soluble hormone crosses the cell membrane, enters the nucleus of the cell, and actively turn on genes. And for this example, this gene codes for a protein. The second type of hormones are non-steroidal. So these are going to be protein based. So these are water loving, hydrophilic. So if you're hydrophilic, you're water loving. Steroid hormones, they hate water. they're fat-based, they're hydrophobic. So they cannot cross the cell membrane. So if I can't enter past the cell membrane, my receptor is going to be on the outside. And it's like ringing the doorbell, and then you carry the message inside. So outside the cell on the membrane. And if it's a protein-based hormone, right, that messenger system, playing telephone, is the G protein system. So that's one way to remember. Nonsteroidal, protein, got to use the G protein system. So they do not directly affect your DNA. So here's the example. So I got a hydrophilic hormone, protein hormone. It rings the doorbell on the outside, and you have to carry the message along until it ultimately causes a cellular response. So anywhere along this message pathway, if there's something wrong or something doesn't take place, that would be a disease process. The other type of hormones is a paracrine. So we had endo, inside, exo, outside. Para is next to or close to. So this is local. So they call this a tissue hormone. So prostaglandin is a response to injury. So if you bump your elbow, then you'll have inflammation only in your elbow because it works locally. So next to, local, close by. And then other parts of your body that do not have a gland will also produce hormones. So for example, the GI tract, if you guys recall, the entire 30 feet needs to communicate from mouth to anus. So instead of doing it via the nervous system, the GI system uses hormone. So the stomach releases hormones to tell the intestines food's about to come, and the intestines will tell the large intestines that the waste matter is about to come. Feedback loop. So what causes the glands to secrete their products? So here's an example of the negative feedback loop. So there's two types. So the negative, there's an on and off switch. So when you eat, your sugar level goes up. That's detected in your body. What the pancreas does is it releases insulin. Insulin tells the cells in your body and your liver to use sugar. So the liver will now store that sugar that's in your blood. So that means blood sugar goes down. That's detected in your body. And once it's back to normal, it stops. Okay? There's no more insulin because you don't need it anymore. So that's the negative feedback loop. Here's the diagram again. Another example of the negative feedback loop is your thermostat. And the furnace. Right? So you set your thermostat at, let's say, 70 degrees. So when it detects temperature lower, what kicks on? The heater, right? So if it falls below 70 degrees, the heater turns on, right? To get the heat back up. And once the heat goes back up to 70, Does this still continue to heat the house? No, it cuts off. So that's the negative feedback loop. So once the stimuli stops, then the response stops. So we'll contrast that with the positive feedback loop. So in this case, as long as there's stimuli, the result's going to happen. So for example, if a nursing mother hears an infant or a child crying, then a little oxytocin is released, and that causes ejection of milk from the milk ducts. So as long as we still hear the crying, there'll always be a release of milk, as long as there's milk to release. So it just continues on. All right, this diagram summarizes the position of the glands. So the pineal gland, it's in the center of the brain. That's going to make melatonin. The pituitary, they usually say it's at the base of the brain. And if they need to do surgery, they'll go right through your nasal cavity. Above the pituitary is the hypothalamus. That is the bridge between the nervous system and the endocrine system. Where your trachea is, you have your thyroid. That's the bow shape here. And then embedded within the thyroid are your parathyroid. So they're next to or near. Above your heart, you have the thymus. Added to your renals are your adrenals. The renals are your kidneys. So right above. And then behind your stomach, you have the pancreas. And we'll talk about insulin and diabetes. And then lastly, the gonads. We cover this in the reproductive system, so we won't cover this too much. All right, let's get into the hormones. What is above the hypothalamus? What is above it? The thalamus, right? Because hypo means below. So you have the bridge between the nervous system. So the thalamus is the nervous system. And then below the hypothalamus is the pituitary. So the hypothalamus produces, so it makes these two hormones. Oxytocin, we talked about, for contraction and releasing of milk. An antidiuretic hormone. So this keeps water in your body, keeping your blood pressure up. So the hypothalamus makes these two hormones, but it is stored and released in the posterior pituitary. So the posterior pituitary is more nervous system. So it's the neural hypothesis. That's it for the posterior pituitary. Only those two products are stored and released. So you can see here where the hypothalamus is. And embedded in the stellica tunica is the pituitary. So we have both the anterior lobe, the front portion, and the posterior lobe. All right, so the posterior lobe is easier. It only has those two hormones, oxytocin and antidiuretic hormone. So the anterior lobe is going to produce a lot more hormone. It's more glandular, so they'll call this the adeno hypothesis. the anterior lobe. Now don't get bogged down with the names. The names just tell you what it does. So if you know the names, break it down, it makes it easy. So growth hormone's easy. Just goes to tissue for growth and repair. Melanocyte stimulating hormone. So melanocytes are the cells in the skin that produce the pigment melanin. So the hormone tells you what it does. So from the pituitary, it goes to the melanocytes and tells it what to do. Here we have adrenal corticotropic hormone. So where are your adrenals? So they're added to the renals, right? So they're above the kidneys. Corti stands for cortex. So that's the outer surface of the adrenal gland. And tropic means it turns it on. So once it turns it on, it's going to produce its hormone, the cortex hormones. Thyroid stimulating hormone, that's going to go to the thyroid. And then the thyroid is going to produce its hormone, which is thyroid hormone. So the pituitary is sometimes called the master gland because it goes to here, it goes to there, it goes to there, and it turns on the other glands. So a lot more. So the posterior pituitary is easy, oxytocin, and antidiuretic hormone. Follicle. What's a follicle? What's an ova? What's an OO? What's an... Yeah, they're all different names of eggs. So this hormone, follicle stimulating hormone, goes and produces the egg in females, and in males it produces sperm. Easy enough. So just look at the names. Luteinizing hormone. You guys recall the corpus luteum? So if there is fertilization, it maintains the corpus luteum. In the males, male hormones. So kind of similar action. Prolactin, what's lactation? Milk. So here it's going to go to the breast for milk production in females. And for males, enhances luteinizing hormone, which enhances testosterone. What are the two hormones stored in the posterior lobe? There's only two. What were they? So we have antidiuretic hormone. So this helps you hold on to water. That maintains blood pressure so you don't go into shock. Shock is when your blood pressure drops, pretty much dead, go into a coma. And the other is oxytocin. So contraction, brand name Pitocin. So they'll give you an oxytocin drip to induce labor. When a mother hears a baby cry, a little milk will be injected because of that oxytocin release. And then for ejaculation during orgasm, oxytocin causes release of the semen. Thyroid. So right where your vocal cords are, right where your windpipe tracheolarynx is. So embedded within is usually 4 nodules of the parathyroid, but sometimes people have 6, 5 more. Excuse me. And then that just means they have more parathyroid function than normal. You go to a doctor and then the doctor says you have a thyroid. Is it the same thing? A thyroid issue or a thyroid problem? Yeah. I don't know, like, what's the difference? Well, you can have it where you're producing too much. So if you have too much thyroid, that's hyper. that means your metabolism will also be high. So you're going to be very thin. If you have low, which is hypothyroidism, then your metabolism is going to be slow, and then you're going to tend to gain weight. So a weight issue can be a thyroid problem. So if you're making too much, that's easy. We just kill off some of it. If you're not making enough, we'll just give you the hormone as a drug for the rest of your life. Same thing with the parathyroid hormone. If you have 6 of them, well, we'll just remove a couple. Hopefully that's enough to bring your levels back to normal. So that's gonna maintain metabolism. So healthy metabolism, you're gonna make protein. When you go into stress, you do the opposite. So you need adequate thyroid function. And the thyroid is probably the only part in your body that uses iodine. So if you're not getting enough, then you might get a thyroid issue. Where can you get iodine in your diet? You guys ever heard of ionized salt, table salt? So that's why they add it in table salt. So it supplements your iodine intake. The second hormone is calcitonin, and as the name states, regulates calcium. It takes calcium from the blood and put it into the bones. So blasts, osteoblasts, are bone cells that build bone. So it takes the calcium from the blood and puts it into the bones. So if you have osteoporosis, I can give you this. As long as we have the calcium in your blood, it'll then build stronger bones, osteoblasts. The opposite of calcitonin will be parathyroid hormone. It does the opposite with calcium. It takes it from the bone and dumps it into the blood. So it does the exact opposite. So the osteoclast will crush bone. So they'll dissolve the bone, take that calcium, and put it into the blood. So those two will need to balance each other, calcitonin and parathyroid. So calcium is important in the blood. It's a clotting factor. You need it for muscle contraction, and it's an electrolyte. Very important. Adrenals. Added to the renals, supra means above. So above the renals is the adrenals. So there's 2 parts, the cortex, which is the outer surface, and then the medulla, which is the middle. So we'll talk about a couple functions of the cortex, but the medulla will only have one function, and that is adrenaline, right? Hence the name adrenal. Adrenaline comes from the adrenal gland. So the middle portion produces epi and norepi. So they're pretty much similar. Collectively, that's what we mean when we say adrenaline. So that is going to upregulate flight or flight, and that stimulates your sympathetic nervous system. The cortex. So the outer surface has multiple functions. We'll just mention 2 of them. So the first one is similar to antidiuretic hormone. So antidiuretic hormone holds on to water. Aldosterone holds on to water by holding on to salt. Anytime there is salt, you have to have water with it. So if you hold on to salt, your body's going to hold on to water. In maintaining blood pressure, keeping you from going into shock. The second function is the stress hormone cortisol. So in short bursts, this is okay. But in our society, we usually deal with prolonged stress. So it does the opposite. So if you're not making protein, then you're going to be making a lot of fat and storing it. Decreases inflammation, so it's going to affect your immune system as well. The pancreas. Exocrine function was for digestion. So it made digested enzymes and it dumped it via a duct into the duodenum of the small intestines. Here we're going to talk about its endocrine function, insulin and glucagon. So on the islets of Langerhans, you have these cells. So the alpha cells will produce glucagon, and the beta cells will produce insulin. Here the endocrine function, here the exocrine function, the product is dumped via a duct into the duodenum. But here in the endocrine function, it just goes straight into the blood supply. So the pancreas has both. Exo for digestion, endo for hormones. So as mentioned, alpha makes glucagon, beta cells produces insulin. So glucagon works by maintaining blood sugar. So normal blood sugar should be around 80 to 120. After you eat, it's going to go up, but a few hours later, it should go back to normal. So when you fall too low, we'll need to get that blood sugar back to normal. So if you're at 20, right, that's not enough sugar. So we'll need to get it back up. So glucagon is released by the pancreas to get that blood sugar back. Insulin is the exact opposite. So after you eat, your blood sugar is going to go up, maybe 200, 300. And insulin will get that blood sugar to go back down, telling your cells to take it up. The pineal body. So a couple functions, but we'll just mention melatonin. So don't get mistaken with melanocytes that makes melanin. This is melatonin. Circadian rhythm is your sleep-wake cycle. So it responds to the dark. So when it gets dark outside, melatonin is released, getting your body to go to sleep. But what do we do now? What do we put in front of our faces before we go to sleep now? So we're getting extra light and we're not getting dark. So we stay up later. Thymus produces thymosin, which is for the immune system. Then we have the gonads. So for females, estrogen are the female hormones. Progesterone are actually male hormones. They're actually androgens that are in the female body. So that cycling is the cycling of estrogen. Starts high at the beginning of the menstrual cycle. Then it dips down, days 1 through 28. And then for progesterone, it starts low, the male hormones, and then midway it kind of peaks. So that's what they mean by the menstrual cycle. And then men, testes, produce testosterone. But men also have estrogens. So if someone wants to abuse anabolic steroids, they're going to take testosterone. But the body will naturally balance that and also increase estrogens. So if you really want to cheat and use steroids for sports, you're going to have to block estrogen in your body. The downside, once your body's getting testosterone from the outside, the testes stop working. So if you go off testosterone, your testes will no longer produce testosterone. And here we'll just mention some of the other hormones. Don't have a gland, specific gland, but it'll still produce hormone. So as mentioned in the GI tract, the stomach will communicate with other parts of the GI system. So it produces gas. Small intestines will produce secretin, right? Stimulating secretion of enzymes. Cholecystokinin, so that's going to stimulate the release of bile. The heart also produces its own hormones. Natriuretic, so that's going to be for sodium. So the chemical symbol for sodium is Na. Kidneys, very importantly, produces erythropoietin, which is, erythro is red, and this is stimulating red blood cell. So if you have kidney failure, you're also going to have anemia because you're not producing erythropoietin. So this is the street name EPO or epogen. So athletes also abuse epogen to increase red blood cells. That way they can hold on or utilize more oxygen, have more stamina, and win more championships. All right, stressors. So make sure you spell it correctly with an OR, not an ER. So that's any stimuli that produces stress. So some things are negative that produce stress. Some things can be rather positive and still produce stress. For example, first day of school. Right? That's a positive thing, but it still can produce stress. Right? Lions, tigers, and bears jump into the classroom. Definitely, that's going to produce stress. That might be a negative stimuli. General stress syndrome. So stress is actually a good thing, but it should be only short-term stress. So when the saber-toothed tiger jumped out at the caveman, they got that adrenaline rush and they're able to respond, right? So that was a survival mechanism. But in modern society, we don't really face those dangers and we don't have an outlet for the stress that we do have, right? So the stress we have, waking up late, traffic for work, not getting your work done, your classwork done. So we don't have outlets. In caveman days, he survived. That was his outlet. So what causes stress? Psychological, in your head. It could be hormonal. For example, epinephrine is also used in surgery. So lidocaine, sometimes I'll use epinephrine to close off blood vessels in that tissue to stop bleeding. But if the dentist is bad and they injected it into a vein, you're going to get the same flight or flight response as you would in the sympathetic nervous system. So everything that mimics flight or flight, increased heart rate, increased respiration, increased blood pressure. Short term, that's okay to get away from that saber-toothed tiger. But throughout the day, throughout work. Now you're going home from work, sitting in more traffic. You go home, you get a fight with your spouse, your kid fails, then you try to go to bed, but you can't sleep because you're on your cell phone, right? So that's going to increase your stress level. You need that release. The hormone of stress, cortisol. Protein down, fat increases. So the exact opposite of healthy conditions. Okay, now let's get into the diseases and disorders. Acromegaly. Agro means the extremities. So fingers, toes, head, jaws. When you have too much growth hormone, as an adult, it's only the ends of your body that grows. Hands, chins, foreheads, feet. So adults who abuse human growth hormones, athletes, their head will get larger. Acromegaly, enlargement of the extremities, due to growth hormone. Next we have Addison's disease. So this is not enough corticosteroids. So from the cortex, not producing enough. And so hypo. So JFK actually suffered from Addison's disease, and that was one of the reasons he got killed. So how did JFK die? He got shot. No, Addison's killed him. So Addison's caused him to have kind of weak bones, so he has a brace to keep him upright. So that first shot, most people who got shot, they would slump over. But since he was in a brace to keep him upright, he stayed upright for the second shot. So what killed JFK? I don't know. IDK. You're gonna have to watch the movie. Cushing's. Hypercortisol. So what's cortisol? Stress. So what's gonna happen with fat? Increase fat. So you're gonna store it everywhere. So you might get the buffalo hump, back of the neck, a round face, the moon face, sometimes behind the eyes. So you might get bug eyes, right? Diabetes insipidus. So there's two types of diabetes. There's diabetes mellitus, diabetes insipidus. So diabetes means to flow. So any condition that causes you to flow like a fountain, that means to urinate, right? So you might have a lot of thirst and you urinate. This one is insipidus. So insipidus means tasteless. So when the doctor in ancient times diagnosing your diabetes, your flowing condition, taste your urine, and if it was tasteless, it was watch your mouth, anti-diuretic hormone. Not enough. So your body is not holding on to the water. Yes, ma'am.
Back in the day, the original lab test,
No, no.
that they would smell urine and certain urine smells, like sweet smells and stuff, they'll be able to test for diabetes and pregnancy and other stuff.
Yeah, that's still a good diagnostic tool today. So you can still smell it. But yeah, we're not tasting anything anymore these days. Yes. Oh, yeah, there's a lot of wise tale. Urine's supposed to be sterile, right? Your urine is supposed to be sterile. So in that case, maybe, but depending on the pH, it might hurt your eyes. Yeah, depending on the pH, it might sting a little bit.
With chlamydia in his eye.
Yes, that can happen.
So, yeah.
So no, do not do that.
Yes, you can.
The urine inside the bladder is sterile, but on its way to the outside world, it might pick up bacteria. So, no,
That's
do
why
not
they
do that.
sometimes have you wipe a certain way with the wipes.
Oh, is it like,
Because
ooh.
it's clean catch. They want sterile catheterize. It all depends. The
Yeah.
surface might not be right.
Yeah, you guys will go through all those procedures in your lab classes. Diabetes mellitus. This time you're flowing, and instead of being insipidus, now it's going to be sweet tasting. Right? So now you have a sugar problem. There's so much sugar in your blood that is now leaking into your urine. Type 1, adult or juvenile? Juvenile. Usually what happens is your body kills off all your beta cells. You no longer produce insulin, so now on for the rest of your life you need insulin. Usually it's in your immune system kills it off. Type 2, usually adult onset. Yes, that is one example. Obesity, and that's caused by eating too much. So when your blood sugar goes up, your body needs to release a lot of insulin. So what did you do? You stress out your beta cells. Now that when you eat, they don't make enough. So that's one cause of type 2. Another cause of type 2 is insensitivity. There's plenty of insulin, but your body goes, don't worry about it, it's always here. Because you eat too much and there's always insulin around. Gestational during pregnancy. So if your child gets too large, that can be a problem during delivery. So they'll monitor it and make sure during that last trimester there is a healthy birth weight. Dwarfism, not enough human growth hormone. So there's only a couple indications where you can use human growth hormone. So I think by definition, if you're 410 or below, is it 4.8 now? You can use, I think for the drug, if you're 410 or below, you can use human growth hormone to get up to a normal stature. But I think 4.8 is the definition nowadays for a little person. So not enough human growth hormone throughout life.
My brother has a phobia.
He has a phobia of little people. I think they like being called little people. So you can't say midgets or dwarfs. You have to say little people.
But he'll go through the drywall.
Oh yeah.
I don't know why.
Too much human growth hormone, you're going to get gigantism. And this starts from a young age. So if it's in adults, it's only the ends that grow, acromegaly. So steroid abusers, human growth hormone abusers, you'll get that growth at the ends. But gigantism throughout life. A goiter, so the enlargement of the thyroid. Either you have too much iodine, too little iodine, too much thyroid, or too little thyroid function, right? It all depends on your condition. So in the case of deficiency, right, where can you get iodine in your diet? Salt, ionized salt. So kosher salt, is there iodine? Sea salt, is there iodine? Himalayan pink salt.
You need the lady with the umbrella.
So they add it because people who eat seafood, that's a natural source of iodine. So if you're landlocked, then you're not going to get that adequate iodine. So get it from your salt.
If you're
Landlocked. So if you're in the middle, no ocean access, you're not going to be eating seafood. So you won't get a lot of iodine from your diet. So you can get it from those purple potatoes. If you ever eaten those purple potatoes and your tongue kind of goes a little numb, that's the iodine. So because you have a deficiency in iodine in your diet or absorption, your body goes, hey, I need to grow bigger to make more of what I'm not making enough of. Right? So that's one way your body will compensate. Lastly, Graves' disease. A couple more. Well, Graves' disease, hyperthyroidism. So here your metabolism is high. So you see this person's a little bit thin. Their eyes pop out. So exo to the outside. Ophthalm is eyes. So you got redistribution of fat behind the eyes, pushing them forward. Cretinism. So hypothyroidism, either by no thyroidism during birth or removal. So severe birth defects, as you can see by the facial features. Hypothyroidism in adulthood, usually by removal, myxoderma. All right, that brings us to the end. Your access code for the assignment is in class, all lowercase.